don't really know what I'm walking into.
This is Dr. Arghavan Salles, who used her 2 weeks of vacation and travelled across the country to volunteer in an ICU in one of New York's hardest hit hospitals.
Sometimes we're really struggling to get enough oxygen into their lungs when they're laying on their back, and then we turn them over and you can tell that there's a benefit.
A lot of these patients have injuries to their kidneys from the disease and from their blood pressure being low and having trouble with oxygen, and so now they need dialysis. There's only so many machines, there's only so many nurses, there's only so many hours in a day. So who gets it? Who is deciding who gets it? Who signed up to be rationing care? I don't think any of us did.
We have 3 vaccines, and 2 of those 3, so the Pfizer and the Moderna one, both use mRNA as the modality. And that technique and that technology was developed by a woman. So if you want to talk about the importance of women to vaccines, right there you have it.
It's 2020, yet somehow it still feels like our world was built with only men in mind.
Most of the PPE is designed for a standard European man. For the best eye protection, you want the goggles that seal. Well, the ones that seal are like this on my face.
I think we have to acknowledge that there are disparities that pre-exist in our society that are due to economic and political and other reasons, and those are now being amplified.
Are we understanding the role of obesity any better?
One of the theories is that because we know that people with obesity have higher inflammation in their system, they live in a chronic inflammatory state, and instead of defending our body, it might actually be putting us at greater risk.
I appreciate you translating that, because I can hear you going from medical journals to talking to us lay people, and that makes sense.
All residents, regardless of their gender, believed that faculty, residents, and the general public expect men to be better surgeons than women.
Dr. Salles has now attempted 2 cycles to freeze her eggs. It's why she wrote an article for Time magazine with the headline, "I spent my fertile years training to be a surgeon. Now it might be too late for me to have a baby."
Family, ultimately, I think, is what really matters to most of us.
It is really important to stay fit. This is actually a decent time to start developing your own practice of some kind that's going to be about mindfulness and taking care of yourself. So I think that's important.
If you'd known then what you know now, would you still have come?
Yeah. In retrospect, I would have come earlier.
Thank you.
Thank you.
Go on, save some lives.